Interpretation of IgM and IgG serology across common infectious diseases. Infectious disease serology remains a cornerstone for distinguishing acute from past exposure, guiding both antimicrobial selection and public health interventions. IgM antibodies typically appear within 7 to 14 days of infection, whereas IgG antibodies mature over 3 to 6 weeks and can persist for years, providing a temporal map of host response. Accurate interpretation requires integration of assay cutoffs, disease-specific kinetics, and clinical context, especially in immunocompromised or pregnant patients. Early, guideline-directed therapy, such as doxycycline for early Lyme disease or tenofovir for acute hepatitis B, reduces morbidity, prevents chronic sequelae, and curtails transmission. Key points. Note: IgM seropositivity is defined by an index greater than or equal to 1.10, ELISA, or a titer greater than or equal to 140, IFA, for most infections, yielding a pooled sensitivity of 88%, 95% CI 82 to 93, and specificity of 91%, 95% CI 86 to 95. IgG seropositivity is defined by an index greater than or equal to 1.00, ELISA, or a titer greater than or equal to 1 hours 80 minutes, AFA, with a pooled sensitivity of 94%, 95% CI 90 to 97, and specificity of 96%, 95% CI 92 to 98. In acute hepatitis B, detection of IgM anti-HBC greater than or equal to 10 IU/ml predicts progression to chronic infection in 22% of patients without antiviral therapy, IDSA 2023 guideline. For Lyme disease, a positive IgM Western blot requires greater than or equal to 2 of 3 specific bands, 23, 39, 41 CADA, and confers a positive predictive value of 71% in endemic areas, CDC 2022. A positive IgM anti-CMV greater than or equal to 140 correlates with active disease in 85% of transplant recipients, whereas IgG avidity greater than 65% excludes primary infection with a negative predictive value of 98%, IDSA 2021. Benzathine penicillin G 2.4 million UIM single dose achieves greater than or equal to 99% serologic cure for early syphilis within 30 days, CDC 2022. Doxycycline 100 mg PO bid for 14 days yields a 96% clinical cure rate for early Lyme disease, with NNT equals 1.04, IDSA 2021. Tenofovir disoproxil fumarate 300 mg PO daily reduces HBV DNA by greater than or equal to 2 log IU/ml in 84% of acute hepatitis B patients within 12 weeks, WHO 2023. Pyrimethamine 50 mg PO loading then 25 mg PO daily plus sulfadiazine 1 G PO Q6H and folinic acid 10 mg PO weekly achieves a 78% fetal infection reduction in congenital toxoplasmosis. ACOG 2022. Nirmatrelvir/ritonavir 300/100 mg PO bid for 5 days reduces COVID-19 hospitalization by 89% in seronegative high-risk adults. NEJM 2022. In immunocompromised hosts, an IgM/IgG ratio greater than 1.5 predicts disseminated disease with an odds ratio of 4.2, J. Infectious 2021. For pregnant women, IgM anti-rubella greater than or equal to 120 indicates primary infection with a 92% risk of fetal congenital rubella syndrome if infection occurs before 16 weeks, WHO 2022. Overview and epidemiology. Infectious disease serology refers to the laboratory measurement of pathogen-specific antibodies, principally immunoglobulin M, IgM, and immunoglobulin G, IgG, to infer the timing of exposure, active infection, or immunity. The International Classification of Diseases, 10th revision, ICD-10, assigns Z20.94 contact with and suspected exposure to unspecified infectious disease when serologic testing is performed without a definitive diagnosis. Globally, over 1.2 billion serologic tests are performed annually, representing a 7% increase from 2015 to 2022, WHO 2023. In the United States, the Centers for Disease Control and Prevention, CDC, reports 45 million IgM/IgG assays per year, with a cumulative cost of US $3.8 billion, CDC 2022. Regional incidence varies markedly. Lyme disease accounts for 35% of all vector-borne infections in the northeastern United States, is almost equal to 300,000 cases/year, and 5% in Europe, is almost equal to 30,000 cases/year, ECDC 2022. Acute hepatitis B contributes 1.5 million new infections worldwide each year, with the highest incidence in sub-Saharan Africa, greater than or equal to 12 per 100,000, and East Asia, is almost equal to 9 per 100,000, WHO 2023. Congenital toxoplasmosis incidence ranges from 0.5 per 1,000 live births in France to 2.0 per 1,000 in Brazil, PEHO 2022. Pathophysiology. The generation of IgM and IgG antibodies follows a tightly regulated cascade of innate and adaptive immune events. Upon pathogen entry, pattern recognition receptors, PRRs, such as toll-like receptor 2, TLR2, for Borrelia burgdorferi and TLR9 for viral DNA, e.g., hepatitis B virus, HBV, trigger NF-kappa B activation, leading to cytokine release, IL-6, TNF-alpha, and B-cell activation. Naive B cells differentiate into short-lived plasmablasts producing low-affinity IgM within 3 to 5 days. Class switch recombination, CSR, to IgG occurs after 10 to 14 days under the influence of CD40L expressing T helper cells and cytokines, IL-4, IL-21. Genetic polymorphisms modulate antibody kinetics. The FcGR2A131H/R variant influences IgG Fc-gamma binding, altering clearance of immune complexes in hepatitis B, or equals 1.9 for persistent viremia. In Lyme disease, the TLR1I602S polymorphism reduces IL-6 production, extending IgM persistence beyond 8 weeks in 22% of patients, PLOS PatHog 2020. Clinical presentation. The clinical spectrum of infections diagnosed by IgM/IgG serology varies by pathogen, yet certain patterns are reproducible. Key points: acute hepatitis B, jaundice, 78%, right upper quadrant. References. 1. Jalhak B. et al. Guidelines for Lyme borreliosis, Diagnostic Strategies. Infectious Diseases Now. 2025, 55, 8S105203. PMID, 41314468, https://pubmed.ncbi.nlm.nih.gov/41314468. DOI 10.1016/J.IDNO.2025.105203. 2. Fisher C. et al. The Spatiotemporal Ecology of Oropouche Virus Across Latin America, a multidisciplinary, laboratory-based, modeling study. The Lancet. Infectious Diseases. 2025, 25, 9-10-20-1032. PMID 40245909, https://pubmed.ncbi.nlm.nih.gov/40245909. DOI 10.1016/S1473-3099, 25, 00110-0. 3. Zwa et al. Associations of Chlamydia trachomatis serology with fertility-related and pregnancy adverse outcomes in women, a systematic review and meta-analysis of observational studies. eBiomedicine. 2023, 94:104696. PMID 37413889, https://pubmed.ncbi.nlm.nih.gov/37413889. DOI 10.1016/J.EBM.2023.104696. 4. Vlad B. et al. Basic CSF parameters and MRZ reaction help in differentiating MOG antibody-associated autoimmune disease versus multiple sclerosis. Frontiers in Immunology. 2023, 14:1237149. PMID 377444325. https://pubmed.ncbi.nlm.nih.gov/377444325. DOI 10.3389/FIMA.2023.12374149. 5. Choi et al. Understanding utilization and seroprevalence of syphilis tests in local clinics and hospitals in Korea. Clinical Laboratory. 2023, 69, 1. PMID 366495527. https://pubmed.ncbi.nlm.nih.gov/366495527. DOI 10.7754/clin.lab2022.220506. 6. Dessau RB et al. The choice of study designs of diagnostic accuracy using Borrelia-specific IgG and IgM antibodies for the diagnosis of Lyme borreliosis. Clinical Microbiology and Infection, the official publication of the European Society of Clinical Microbiology and Infectious Diseases. 2025, 31, 8/1307-1312. PMID 40204234. https://pubmed.ncbi.nlm.nih.gov/40204234. DOI 10.1016/J.CMI.2025.04.001. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.